We live in an amazing time. The level of medical care in this country is unquestionably the highest in the world. Technology provides sophisticated tools for diagnosis and treatment that we didn't imagine even 10 years ago. There's a lot to be proud of. But despite all the discoveries and the high tech, and maybe even sometimes because of the discoveries and the high tech, the thing that's so difficult for healthcare professionals is helping a patient face death. After all, doctors and nurses are trained to save lives, to do everything in their power to prolong life. But there's more to the end of life than just the medical perspective.
We need to be thinking, what is it that the patient really wants? And we need to serve their needs rather than our own inner desire to try to save another life. If that's not in the patient's best interest, and who judges the patient's best interest but the patient, not us?
We believe that often the very best help a healthcare professional can give is to introduce a patient to hospice care. A hospice like Namaste broadens the circle of caring for a patient by creating a partnership between the doctor and the hospice team. Then the hospice professionals can provide the day-to-day support for the patient and family as they decide how to best live this final stage of life.
We listen carefully to what their desires and priorities are, and then fashion our care to fit that, instead of having them march to our tune.
We, the professionals, the nurses, the doctors, the social workers, the chaplain, the aides, we consider ourselves to be people with expertise and not the experts. Our job is to educate our patient and families about all the options that may be available to them, benefits and burdens associated with each option, and then empower them to choose whatever fits best for them.
That's what we call the Namaste choice, that everyone has a right to live fully and die well. During the next few minutes, you'll hear why doctors, nurses, and other team members see this as both professionally and personally satisfying. And you'll meet two families who've made the Namaste choice. Walter Smith, for example, is elderly with terminal cancer. His story exemplifies the Namaste value that palliation is valid and appropriate at any stage, not just as the last resort. His daughter Myrna remembers a pivotal moment of choice.
He was in the hospital 2 times for 10 days for an infection, taking antibiotics intravenously, and he hated it. And he said, "I'm not doing this anymore." So we said, okay.
Ironically, sometimes switching to palliative care helps the patient live longer than anyone had expected. In Walter's case, 2 years. Now it's time for more pain management.
Walter's cancer is spreading throughout his body, so we're trying to find different modalities to keep him comfortable and to give him a good quality of life.
My job as a nurse is to get somebody comfortable so that they can do the important work. I get them to a point where they can do the things that the social workers and chaplains are trained to do with them. That's really the important part of hospice there, and it's the biggest part of hospice.
I put away childish things. For now we see through a glass darkly.
To be able to be open to what's been most deeply meaningful, their struggles, unfinished business, what sort of things are hanging around. Sometimes people are still feeling nagging guilt for something that happened a long time ago. And through the role of the chaplain, and being open to forming a relationship, maybe we've watched a Bronco game or two, then we can open up and find out, it's okay. It's okay, that's past, and you don't have to be worrying about that one. And God's not holding it against you, and I'm not either.
I will sit with the family and we will talk. And we will discuss what's going on in their life and how we can be of service to them. Because they also need to take care of themselves. This is a process not only for the patient but for the family. It affects everybody involved.
For a family to be able to look to someone else to give them answers when we don't know any answers, and to give us emotional support, to give our dad emotional support, it's made all the difference in the world, in our well-being as well as his.
I felt like I had support. Before, my husband was my support, And all of a sudden, I had a team of support who did understand what we're going through. And I truly had no idea this was available. And we have talked to quite a few people that weren't as blessed to be led to it like we were. And therefore, they only get to take advantage of it the last few days or weeks. And so they still have no understanding what a support it can be for everyone.
Lainey and her family know that support very well. Both of her parents were under Namaste care. And although her mother recently passed away, Lainey, her dad Willard, her family, and the Namaste chaplain often honor her mother's passing by remembering a few of her favorite hymns.
They knew she loved to sing. They knew she loved to read the Bible. So whenever any of the CNA or the nurse would come, they would do singing, reading the Bible, and just spend time loving. And that is truly what meant the most to me. And knowing that there were other people there that loved her, showed her the same kind of love that we did. And that's what meant the most.
Another Namaste value, and it's one that really sets this hospice apart, is the bias towards yes. Yes to people of all faiths and backgrounds. Yes to people who want to keep living alone. And even yes to people without financial resources.
There are still people who don't have reimbursement available. They don't have Medicare, they don't have Medicaid or private insurance. Still, they're dying and they need the service. And so one of the things that I'm absolutely passionately committed to, a thing that my accountant just can't understand, is that I will never ever say no to somebody based on an inability to pay for services.
All my experiences with Namaste have really been wonderful. They've have been really responsive to the needs of our kind of distinct population. They come right over when we call, and one thing kind of refreshing is they're willing to take anybody. For people who don't have any insurance, who don't have any support, to suddenly say to them, these people will come to your house and they'll help you through this difficult time, that really does make a difference for people, and that makes my job nice too, to be able to align that for people.
The work that Namaste has done and their mission and making sure that they can help people out regardless of their ability to pay has been extremely helpful for very many clients. We still keep delivering the medical care here at the clinic, and what they can help with is specific hospice care, case management services, helping clients make it to their appointments, helping them with their daily needs and activities of daily living, in a way with hands-on services that we as a Healthcare for the Homeless clinic for medical and mental health, and other services as well that we can't actually provide as easily as they can.
We all have the right to decide how to live our lives, and that includes the end of life. That's where Namaste can help. The nurses, CNAs, social workers, and chaplains have the time for the long visits and talks with the patient. To complement traditional pain management, the team of caring hospice professionals can provide massage, music, and movement therapies to make the patient more comfortable. They check in with the doctor, but the Namaste team also frees the doctor to focus on other patients who can be helped with medical treatment.
I find that it makes me feel better taking care of patients who have those people handling the social issues that I don't really have the skills and training to do. And I can help with the medical issues, which I do have the skills and training to do.
When the diagnosis of terminal illness hits a patient and their family, it's like an avalanche. It's like everything in their life feels out of control. Issues come up about living conditions, how they're going to do self-care, daily things like get fed and cleaned. They feel completely out of control, and they're very vulnerable to relinquishing control to somebody who says, this is what we need to do. What Namaste believes very passionately is that there are still issues around which you can hope, And there are still many areas in which you should maintain control of the quality of these last precious days. And for that reason, what we do is, with listening, with teaching, with the supports and services available, we try to help people find those areas where they can reclaim control. If you had a wish for these last precious days of your life, what would it be? What are your biggest fears toward the end of life? And how can we help you whittle those down to size? So it becomes the heart and soul of everything we do. Instead of our saying, we have a plan for you, we say, what is your plan for us? How can we facilitate the way you want it to look?
The word Namaste comes from the Sanskrit language. As a greeting, it means the divine in me bows to the divine in you. Doctors and other healthcare professionals who want the best for their patients do the right thing by recommending Namaste. There truly is no greater service to patients who are facing the certain end of life than to support them and help them live fully and die well. That is the Namaste choice.